Hello everyone. In this video, we're going to study the PK-PD relationship. We're going to take an overview on what is PK, what is PD, and why we need to study the relationship of these two concepts. Let's start with PK, which is the pharmacokinetic. It studies the relationship between the plasma concentration of any drug with time, and it is represented by the exposure curve as shown here. While PD, which is the pharmacodynamic, it correlates the concentration of a drug in the plasma with its response or the observed effect, and it is represented by the exposure response curve. When we combine these two concepts together, we get something called the PK-PD, which is the time course of a response. So we're getting the time from the PK and the response from the PD. And we're having this type of curve here. But why we need to combine them together? Why can't we just depend on PK alone or PD by its own? To better understand this, let's take this example here. So let's say we're having this graph here, and on the y-axis on your left side is the concentration of the drug. On the x-axis we're having the time in hours, and on the y-axis on the right side we're having the effect or the drug response. Let's say we're taking 2 points of time. First is after 2 hours of administering the drug to the patient, and second point is after 18 hours. If we want to measure the concentration of a drug in the plasma after we give the drug to the patient by 2 hours, we want to know the PK. So we want to consider the concentration versus time curve, which is represented by this green curve here. So you can see that the concentration at 2 hours is 20 mg per liter. What if we want to know the effect of the drug at that time? So we want to consider the PD, which is this red line here, which is the effect versus time. So at 2 hours, we're having this effect, which is 90. What about after 18 hours? After 18 hours, we measured the concentration in the plasma and it shows 20 mg per liter, same as the previous one, while the effect shows 40. As you can observe that at same concentration we obtained two different effects. How is that possible? Two main reasons can explain this. First one is metabolism. We know that livers and other organs in the body like small intestine can metabolize the drug in terms of converting the drug to a less active or inactive metabolite, a process known as deactivation. The total concentration of a drug equals the active form of the drug plus the inactive metabolite. So the concentration will be always same, but the effect will be reduced when there is formation of metabolite, because these metabolites will not be able to bind to receptor and produce an effect, but still they are in the concentration. The other reason can be due to the receptor. With time and continuous exposure of the receptor to drugs, these receptors get overwhelmed and they lose sensitivity. we call them, they become desensitized. And thus they can't respond well to drugs. And thus you will have this decrease in effect or activity. No matter what the reason is, this graph is just an example to show how PK and PD are highly correlated, and it is important to consider both of them, because you see that we can't just depend on PK and check the concentration, because same concentration can show totally two different effects, and thus we can't just depend on the PK to adjust the doses, because if we increase the dose here, that might increase the concentration, and that can lead to some adverse effect or toxicity, and vice versa. So we can depend on one of them only in dose adjustment or dosing management. We need to consider the relationship of these two for better dosing regimen management. This is the end of this video. I hope you find it helpful. Thank you for watching.